Mr. Parikh, piercings, just like tattoos, are quite fashionable. Can they be the cause of problems as well?
Yes, so in my field of work, I do see patients with piercings, ear piercings, nose piercings, and also tongue piercings. So we see all three of them. Ear piercings are, of course, the commonest, and there are two different types. So the common or the commonest one is, of course, the earlobe piercing. And the second one is the piercing to the rest of the ear. And there are two different kinds, because the earlobe piercing goes to the skin and the soft tissue. And the soft tissue in the earlobe is all essentially fat. Whereas piercings in the rest of the ear goes to the skin and through this stiff material, which is cartilage. So there are slightly different problems that arise with piercings in these two areas. Both are prone to infections, and the infection in the earlobe can be slightly easily managed, but if the infection in the cartilage gets out of hand, then it can be a problem. Cartilage derives its nutrition from its cover, which is called perichondrium. And if there is any infection in this region, it's called chondritis or perichondritis, then the nutrition to this cartilage becomes compromised. And you can even have areas of the cartilage that can die or necrose. And therefore, you can potentially have a deformity that can arise. It can be a minor deformity, which can be just around the piercing, or if the infection spreads, then of course it can be a major problem. Not that common, fortunately. Most outlets that do piercing nowadays use single-use needles. So they are sterile needles, and they are thrown away after being used on someone. But post-piercing hygiene is the important thing, because in the ear particularly, it takes about 6 to 8 weeks to heal and to form the mature hole. And during that period of time, the person who's had the piercing has to be careful. And there is a very good leaflet on the internet from NHS UK about piercings, particularly the ear piercings, and how to look after it. What I would say is that whichever outlet you go to, just make sure that they are very clean and they are using single-use needles, and they give you some instructions post-piercing as to what you should do and not do. Yes. The long-term problems we see, the main one is what we call keloid formation. Keloid is a big scar. So it's like a lump of scar that forms because the tissue has been traumatized. And it is seen, I wouldn't say commonly, but it is seen more often in patients who have dark skin, so Afro-Caribbean patients or even Asian patients. And they develop these big keloids, and that is a real problem because they come to us and they've gone so that they can wear earrings, and then that is replaced with this big lump of tissue. And the biggest problem with it is we can remove it, but there is a huge recurrence rate. And in my experience, most of them recur.
So it comes back.
So it just comes back. So, and it comes back fairly quickly. So within a year, the patient is back with an equally big lump. And the more we remove, the more deformed the earlobe becomes, because we are cutting into normal skin a normal tissue, so patients are left with some deformity. So that is a very big problem that we have with piercings.
Yes, and which you don't hear quite as much as the risk of infection just post.
That's right. Yeah.
And tongue piercings?
Tongue piercings, usually there isn't a big issue. The things that we come across is sometimes we see patients who require, say, some form of throat surgery, say a tonsillectomy or something else, and they have a tongue piercing, and we do like the tongue piercing removed, because sometimes if we use what is called a diathermy, it's like an electrical current to stop bleeding. We don't want a metal bit in the tongue. And so if it doesn't come out, then it becomes an issue, and we have to find different ways of a hemostasis or stopping the bleeding. One other issue with particularly with nose piercings that I've seen is that the stud becomes embedded in the skin. So sometimes these the men or women have the stud on the inside, and then that just migrates under the skin and it becomes stuck. So skin grows over it, so it's under the skin, and sometimes it rubs against the skin and causes problems. So then they want it removed, and there we have to make a cut. We have to go into the nasal soft tissues and take the stud out. Right. So those are the sort of, but the commonest ones that I would say is the infection with the ear and the keloid formation.
Okay, so you're not encouraging people to go for multiple piercings.
Well, I think it's a fashion, so it's beyond me to tell them what to do and not do. But yes, be just careful,
be aware,
and aware of these potential complications.
Mr. Parikh, thank you very much.
Thank you.